Hi, my name is Bobby Lloyd, and I'm an FNP student at Eastern Kentucky University, and this is for NSC 890, and it's my Integrative Review presentation. The Integrative Review presentation is about the health status in rural versus urban populations. Health promotion, including healthy eating and living an active lifestyle, is a major topic in modern prevention of disease. Rural populations are known to have higher incidences of chronic disease and an overall less healthy population. Several studies were reviewed and analyzed to determine the reasons behind rural populations being less healthy. The studies showed that people living in these rural areas have less active lifestyles and eat less healthy foods. This causes a decrease in overall health. Family nurse practitioners have the ability to promote healthier lifestyles in all patients, especially patients living in rural areas, and to determine any barriers each individual patient has to these healthy lifestyle choices. Having a healthy lifestyle consists of healthy eating, living an active lifestyle, along with limiting or avoiding alcoholic beverages, drugs, smoking, tobacco, and avoiding as much stress as possible. You can avoid stress by participating in hobbies, spend time with loved ones, engage in physical activity. There are several national goals associated with health promotion. A couple of these goals are from Healthy People 2020. One of them is to promote health and reduce chronic disease by eating a healthy diet, and the other one is to improve health, fitness, and quality of life through daily physical activity. My clinical question is, how do dietary and activity habits compared to urban areas affect health status within 1 year? 3 studies were selected for review. All 3 studies used the cross-sectional comparative method, and they reviewed previously completed health surveys, and they used these to find any patterns in chronic diseases and what these people were eating, what they were doing every day. And then one of the studies actually reviewed barriers that these people were having to living a healthy lifestyle, and some barriers that were identified. Really, all 3 studies had some barriers, but there was one specific study that went really deep into the barriers that the people in rural populations were having. And the barriers were the fact that rural populations tend to have less money, and they were not able to afford things that would promote a healthy lifestyle, such as healthy foods, and they didn't have any access to gyms or public open areas, playgrounds, and things like that. All 3 studies showed that rural populations eat less healthy foods, they're less active, and they have more chronic diseases. My potential intervention is that nurse practitioners could include a brief conversation with every patient during every encounter about their routine eating and activity habits. By speaking to each patient about these daily habits, the nurse practitioner would be able to identify any problem areas and give advice and identify possible barriers that the patient might have to living a healthy lifestyle. This would be really important because sometimes just bringing up the topic and having a short conversation can encourage someone to live a healthier lifestyle, and it would reduce their chronic diseases.